Cirrhosis is a late consequence of liver injury due to chronic hepatic inflammation or chronic cholestasis. Patients with early, well-compensated cirrhosis may be asymptomatic or present with nonspecific symptoms. Decompensated cirrhosis presents with more severe symptoms such as jaundice from hyperbilirubinemia and pruritus from impaired bile flow. Early symptoms of hepatic encephalopathy include sleep disturbances, while late symptoms include mood changes, disorientation, and confusion. Patients may also present with signs of portal hypertension. Melena or hematemesis may indicate variceal bleeding. On physical exam, look for signs of hyperestrogenism, including spider angiomata, gynecomastia, testicular atrophy, and palmar erythema. Also assess for signs of hepatic encephalopathy, including asterixis, ataxia, slurred speech, and nystagmus. Signs of portal hypertension on physical exam include caput medusae, fluid wave and shifting dullness to percussion, and splenomegaly. On labs, expect mildly or moderately elevated ALT and AST, although these can be normal, especially in advanced disease. Bilirubin levels typically remain normal until the decompensated stage, at which point a conjugated hyperbilirubinemia is typical. Conjugated hyperbilirubinemia can show up earlier if a chronic cholestatic disorder, such as PBC or PSC, is causing the cirrhosis. These disorders are also associated with significant elevations in ALK-Phos. ALK-Phos is usually normal or mildly elevated with hepatocellular causes of cirrhosis. You may see thrombocytopenia due to platelet sequestration. And as the cirrhotic liver begins to fail, expect decreased synthetic function in the form of hypoalbuminemia and prolonged PT and INR. Measuring serum ammonia is controversial, but it's typically elevated in hepatic encephalopathy. Hyponatremia and a rise in creatinine may be a sign of increased splanchnic pooling, which leads to increased ADH activity and reduced renal perfusion. Abdominal ultrasound is the imaging modality of choice. In advanced cirrhosis, the liver may appear small and nodular. Ultrasound is also used to look for signs of portal hypertension, ascites, and splenomegaly. The gold standard for diagnosing cirrhosis is liver biopsy, but isn't necessary if the clinical, laboratory, and imaging evidence strongly suggests cirrhosis.